Well, the Health Ministry has noted concerns on social media about the possible import into South Africa of the variant of the coronavirus discovered in India, which is battling a massive surge in cases. The ministry has assured South Africans that there are no direct flights from India to South Africa, and authorities are maintaining strict measures to try and ensure that the new variants of the virus do not enter the country. Let's discuss this further. We're now joined via Zoom by Professor Ramneek Ahluwalia, who is the CEO of Higher Health. Thank you so much for joining us, Prof. Always a pleasure to have you on the show with us.
Good afternoon, and thank you very much for having me.
You're most welcome.
Thank you.
Our Health Minister, Dr. Zweli Mkhize, has been saying the last few days that, we should remain calm. But, it's really quite difficult, isn't it, when we hear that this particular strain or variant is called a mutant. What does that actually mean? And is it correct to say that we should remain calm, that we shouldn't panic?
So I think the Indian second wave is a kind of a brutal reminder that COVID exists, and it's non-seasonal. It's summers in India at this moment. And if in summers this virus is causing a havoc, which means clearly sees this virus is actually non-seasonal, it is not confined to region. So the variant B1617 is kind of labeled as double mutant, is a kind of a misnomer. It's a terrible nickname if you ask me. Actually, we've seen 13 mutations in the same variant. Not all viruses keep mutating, so it's not about that every mutation is significant. But there are certain mutations that one has to be very concerned about. And what we saw on this variant is 2 mutations on spike protein, which are of high concern. The one mutation we have seen is called L452R. And I know it's long terminology, but to make it simpler, it's very similar to the mutation we saw in the variant that was first detected in California.
Yeah.
The other mutation we've seen is E484Q. So these are the 2 mutations why it's called double mutant, very similar to the variant we experienced in South Africa, which caused a havoc of our second wave. Now, having 2 concerning variations on the same variant, one that makes it highly transmissible, but the other one that makes it kind of an escape mutation.
Yeah.
And an escape mutation is concerning because for a first wave, when people got infected, it was estimated that about 271 million Indians that was an estimated population that got infected with this virus in the first wave. Remember, it's not about testing people and knowing how many were positive. It's many asymptomatic and many mildly symptomatic who we do not know are positive with this virus. So what they produce is a natural immunity into your body. Now, the concerning part is these viruses are mutating to a level that certain mutants can kind of escape these natural immunity.
Yeah.
And when these viruses start escaping natural immunity is where the havoc of second waves and third waves start coming in. And that is exactly what India is experiencing. And that's why it's totally brutal at this moment.
And Prof, that really does kind of worry me or concern me. I mean, we keep talking about the fact that, we need to get the jabs, we need to get vaccinated. But, when you're talking about the fact that some of these variants may escape immunity, what does that mean then? Does that mean that we'll have to have more jabs, more different sort of vaccines? I mean, what does that all mean when it comes to the vaccination drive, which unfortunately in South Africa as well had to be stalled as well? I mean, doesn't that all kind of come together in a terrible sort of mixing pot that just becomes really combustible?
First of all, vaccines, the kind of immunity vaccines produce is much more stronger than the natural immunity. So vaccines are absolutely one of the ways of how we need to curb this virus. The second important thing which we need to really watch is this mutant not coming to South Africa. But also we have to watch about many other mutants that are being evolved not only in our country, but all across the world. And there's a lot of cross-migration happening. Viruses tend to only stay alive by mutating so that they can fight a human immunity, so that they can survive and they can live. All the virus is doing is trying to live. So vaccine immunity is stronger. Obviously, science will tell us whether which is very new. Remember, this virus is not even a year old to us. So science is going to evolve every time. What we're going to be evaluating is whether the vaccination-induced immunity is stronger enough, and will this virus continuously mutate itself to a level that it might even warrant to escape that immunity further. Right now, all I was speaking was a natural immunity, but not about the vaccinated immunity, which is a stronger immunity produced through a vaccination program.
Yeah.
The virus is going to become endemic. So if you look at influenza virus, every year we ask people to vaccinate through the influenza virus. Why do we say that? Is because a new variant or a strain has evolved, which the old vaccination program does not support. So a second dose or another dose of a booster which is given, or a new vaccine that is given in the following year, helps you protect against that particular strain or a particular mutant.
Yeah.
Too early for us to say whether our vaccines are ineffective. At this moment, vaccines are absolutely effective. And the vaccination is the way of curbing this virus. So we have to support vaccination program.
I hear you, Doctor, on that point regarding vaccinations. But I'd like to ask you then, do you believe that a third wave or third variant, whatever it's to be called, in South Africa is inevitable? I mean, when we see what's happening in other countries, I mean, at some point we didn't think that a second variant would happen, and it did. And I wonder if from where you sit, it's inevitable, the fact that we will experience this third wave. I mean, the fact of the matter as well is that people are suffering from, not wanting to adhere to the protocols. So I wonder if that fatigue, that COVID fatigue, would also then just add to all of it. And the fact that other countries are, experiencing what's been called third waves, is it inevitable?
So human behavior and fatigue is one of the predominant reasons what we're seeing in India at this moment for the whole kind of the brutal wave. So if you look at South Africa now, people have just come out of a second wave. There is a natural immunity against a variant that was produced to curb the second wave. The reality is two things: fatigue and human behavior, and secondly, the evolving virus, which is producing mutations, which is producing kind of variants that kind of start escaping immune responses, that becomes highly transmissible. So the inevitable reality is the third wave is inevitable. But what we can do is, the cluster outbreaks, like for example in institutions of higher learning that we saw in University of Pretoria recently, or we're looking at some congregate settings where a large number of people, or in a municipality where we start seeing a large number of people becoming positive, and quickly investigating whether it is because of the old variant that's still tailoring on with us at this moment, which is causing the COVID infection to spread, or is it really a new mutant virus or a new variant that has evolved in our country or come in our country that is causing high infection? What will eventually happen is quick decision making, quick identification, quick curbing the cluster outbreaks, informing, good communication, thanks to the media to help us do that quite enormously. Producing, the government has been doing quick lockdowns, and that will then again come in quick decision making to start coming back in, rather not having a brutal third wave, or we call it a preventable third wave, or extending or prolonging a third wave. These all measures will only assist in saving human lives. And so the reality is inevitable, but we can succeed if we want to put pressure or exert early detections on this.
And Doctor, just to pick up from your point speaking of government, in fact, and quick lockdowns and quick decision making, there actually is a debate currently taking place about whether or not there should have been, some sort of total shutdown of any flights to or from India the moment that we knew of this new strain or new variant that was discovered in India. What's your take? What's your view on that debate? I mean, I just read a story now that's in our bulletin currently about the fact that we have some South Africans in India, cricketers, who need to come back, to the country. And I just wonder, where you stand on this issue.
I think it's always a difficult decision between preserving an economy versus how much action do we need to take and how much concerns do we need to put in place. I think the most important part is that this variant that we're talking in India is already in about 20 countries already.
Yeah.
So the cross migration is not going to only happen from India. It's going to happen from many other parts of the world. And the question is, how much are we going to block and how much are we going to block everyone? The question is, yes, what we can do is anyone entering South Africa from any part of the world, including at this moment India, yes, because the number of cases in India are extremely high and the rate of positivity is extremely high, which is about 30% or 33%. So the question is, any person coming from India needs to follow those strict measures of 14 days of quarantine, a complete testing program, and following the whole screening mechanism of the COVID, which is important. But this must apply to everyone coming from any part of the world, into any part of the world. So if South Africa is receiving people coming from different parts of the world, that the process of screening, testing, and quarantine is equally important, because the virus it's wrong to say it's an Indian virus or a South African virus. These are not. These are mutants detected in India. Where they got evolved, nobody knows about it, and people only keep suspecting, and it moves. So as I said, if this virus is already in 20 countries, in this mutant, and the other thing we have to be mindful that these mutations are happening even in South Africa, even in our neighbors, in Southern Africa, and across everywhere. So if not this mutant, there are going to be other mutants that are going to be causing the same kind of susceptibility to our country. So I think the process of rigorous testing as well as quarantine towards anybody leaving or coming in South Africa has to be followed, irrespective of the country of origin, because the aim is to ensure that we do not let a mutant from a cross migration enter South Africa and cause a similar havoc that we have experienced currently. And that is exactly where the reason should be around.
Prof, your input is always very much appreciated here at SABC News. We thank you, sir.